There are many confusing periodontal conditions that kind of look the same. It's the same disease that has different hats and looks differently. And when we get confused and we don't have clarity, many times we just abandon. We don't do anything. And we put ourselves at a pretty big liability. Because if you look at a very common periodontal condition with inflammation, and we start thinking about what could it be, and we don't know what the current classification is, we are putting ourselves at the liability. Actually, it's the second most common reason for a dental malpractice lawsuit, the failure to diagnose periodontal disease. And if you just look online, you'll see tons of law firms just soliciting patients about this topic. Tons of companies, tons of law firms that are looking for patients that were not properly diagnosed and treated. And it's not just us, the dentists, it's also our clinical staff, our hygienists will be sued. And the average lawsuit is somewhere in between $125,000 to $400,000, more or less. It's not a small amount. Yes, we have insurance, but this is big. Now, it's so easy to diagnose periodontal disease, especially with the new classification. So in your handout, the classification is there. I'm going to dumb it down, make it super simple, so we can implement. Because if things are too complex, we're not going to implement and we're going to forget about it. So I'll make it real simple. So I'm going to be talking about the new classification and how it works. So we're going to keep it real simple, short and concise. First of all, gingivitis, when we don't have bone loss, all stay the same. How do we classify gingivitis? So gingivitis is very simple. We now call it biofilm-induced gingivitis, BIG, big. It can be either localized or generalized. Localized is less than 30%, generalized more than 30%. Simple. It can be mild, moderate, or severe. That's it. Now what's interesting, even when inflammation is very severe, we don't necessarily see bone loss. So these conditions are very easy to diagnose. These are biofilm-induced or plaque-induced conditions. Sometimes they are non-biofilm-induced, like viral conditions, autoimmune conditions, cancer. They may mimic periodontal disease, but they're not. And that's also very important. That's where many dentists fail. It's something that looks like an inflammatory condition actually has a different etiology, and I'll show you a couple of cases. This is what we call the red zone cases. For our ortho patients, this is basically biofilm-induced gingivitis. It's induced by plaque. If you want to be a little bit more accurate, you can call it biofilm-induced hyperplasia, which we usually treat with resection. So surgical treatment is the treatment of choice. And these conditions, many times, because they're induced by plaque, they basically come back and we need to retreat them over and over again until ortho is done. Okay, so the patient is not allergic to the brackets or the braces, it's induced by plaque. And some patients will be more susceptible. So gingivitis is the same, very simple, localized or generalized, and there are 3 levels of severity. Very simple. But let's talk about periodontitis. This is where we get in trouble and we get confused. So let's keep things simple. Currently, the diagnosis of perio has only 3. From about 10 or 12, it got narrowed down. So things are much simpler. So let's understand what those are. One is a necrotizing condition. One is induced by systemic condition. And what's the last one? Anybody?
Nitrogen.
The last one is periodontitis. That's it. Periodontal disease is now 99% periodontitis. Let's see how we diagnose periodontal disease by staging and a grading system. Okay, so how does that work? So periodontitis can be either localized or generalized, more than 30%, less than 30% of all teeth. It has 4 levels of staging. And it has 3 grades, and I'm going to explain exactly how this works. And it's very, very simple. It's also in your handout. So staging is basically the severity of the condition. How severe the condition is, it's based on the attachment loss. So we need to guesstimate stage 1, attachment loss of 1 to 2 millimeters, stage 2, 3 to 4, stage 3, over 5, and stage 4 is also over 5 or equal to 5. Now these are not pockets. When you just look at the form, if you just look at the handout, you can get confused. But these are not pockets. This is attachment loss. So if assuming the patient doesn't have recession, we're looking at these equivalent probings. So 4 to 5 millimeter pockets, we're looking at stage 1, 6 to 7 stage 2, and over H stage 3 and 4. We also need to look at the interproximal bone loss. And again, very simple. Bone loss in the coronal third of the root is stage 1 and 2. And the lower 2/3 or the apical 2/3 of the root, stage 3 and 4. Very simple. And of course, we're looking at the interproximal bone loss. So let's diagnose a case. Okay, let's get right to it. We see severe bone loss on most of this patient's teeth. By the way, does everybody see this is periodontitis? We're clear on that. Okay, so it's periodontitis. And it's a generalized condition. But what staging is it? 1, 2, 3, or 4? Okay, so if we look at our cheat sheet, we have severe bone loss to the lower 2/3, so it's either 3 or 4. Okay, 1 or 2, there's no tooth loss. This patient is going to lose multiple teeth. The case is going to be quite complex, high complexity case. So this patient has generalized periodontitis stage 4. Let's diagnose a local case. Okay, so this patient has, all in all, healthy bone levels, but specifically on the lower incisors, there's severe bone loss, localized destruction, very deep probing there, 6 to 9 millimeter probings on just the lower incisors. So what would that case be? That would be a localized periodontitis, over 5 millimeters of attachment loss, 8 millimeter pockets. We're looking at stage 3. Less than 4 teeth will be lost. What do we do with these cases? Okay, we need to diagnose them. We all know that we need to remove the etiologic factors. It was so much fun to remove this calculus and let the body heal itself. Periodontal disease can be generalized, localized, and we need to look at the attachment loss. Okay, so what is grading? When we talk about grading, we are talking about the rate of progression. So we have 3 grades, A, B, and C, and it's all about the rate of progression. Is it a slow rate of progression where bone loss and tissue loss is gradual over many years? Is it moderate or pretty rapid? What I recommend to you is start always with grade B. Grade B, these are most of our patients. Somewhere in between, mostly because we don't know. They just present to us. We don't know how long it took for the destruction to occur. So if you can see the bone loss, if you have some evidence, radiographic evidence that they were in pretty stable perio condition and they deteriorate over time and you have some radiographic evidence, you can determine the rate of progression. Most of the time we can't. So one of the things that we do, we take the percentage of bone loss, whether it's 20, 30, 40, 50, 90% bone loss, and we divide it by the patient's age, more or less. And then you have a couple of numbers that will help you determine what grading it is. Okay, that's one thing. Number 2, and that's probably the most important thing, if you're seeing local factors, a lot of local factors, a lot of plaque and calculus, and a lot of destruction, that means that the destruction is proportional to the amount of deposits, or the amount of local factors. And that's usually grade A. In grade B, you see a lot of plaque and calculus, there's going to be a lot of destruction and inflammation. But if it's in reverse, if you don't see any factors or very little of them and you have a lot of destruction, we're looking at grade C. And lastly, we're looking at different risk factors. And there are only 2 that are currently now proven to affect periodontal disease: smoking and diabetes. And you have to see how much is the patient smoking and what is the diabetes control, the glycemic control. So if a patient is a non-smoker, we're looking at grade A. If the patient smokes less than 10 cigarettes a day, Half a pack a day, that's grade B. Over 10 cigarettes, it's already grade C. And there's a direct correlation here. Same thing with diabetes. If they have normal glycemic control, their A1C is about 6. We're looking at grade A. When their glycemic control is close to 7, it's grade B, and over 7, we're looking at C. So if we follow our patients for many years, and this is a 10-year follow-up, we can start seeing some bone loss that developed after 10 years. So this is slow progression. Sometimes progression is pretty fast for a young patient. Okay, so this is a periodontal disease. This is not a mucogingival problem. This is interproximal bone loss, and we have clinical evidence that this is a pretty fast rate of regression. This is a grade C. And sometimes we'll see severe regression in a short period of time, but this is not periodontal disease. This is a mucogingival defect. This is because of a frenum pull and not enough attached tissue. Okay, so we have to differentiate it. If we look at this patient as a perio patient and we start scaling and root planing and put him on a recall and maybe do some perio surgery, all this patient needs is a graft. Okay, so this is not a periodontal patient. It's a periodontal condition that has to do with the soft tissue.